Thank you, Shannon. Thank you for everyone for your time. I'm glad you got the next 8 hours to hang out with us. No, I'm just kidding. It's a quick overview of my job and welcome to everyone. I work for the Boise VA Medical Center. Um, Shannon introduced my title. It's Community Engagement and Partnerships Coordinator. I only say it one time because it is a mouthful to say. But I started off joining the Navy when I was 21, a couple of years after high school graduation. Had no direction in life, and the Navy gave me an outlet and gave me some opportunities and experiences to kind of see life from a different view and lens is what I grew up with. So my job here, um, I, I I work for the VA. I do public health approach to suicide prevention. So I'm going to ask you all to take off your clinical hats just for a minute and kind of sit in the moment in this presentation that I can give you. And any questions that come up, put them in the chat. We'll try to get to them later. But mainly, I just wanted to give an overview of my job. I shared that I was a Navy veteran. I served in Iraq in 2006 with Marine Corps Infantry Unit, 2nd Battalion, 3rd Marines, and a lot of the stories and stuff that I take from my military experience, I'll share some of them today. So we'll get into that, and just wanted to welcome you all. So if we can go to the next slide, going over some of the objectives to identify what it is I'm talking about. It's a new program for the VA, started a few years ago, and historically I have experience doing trauma therapy and sexual trauma counsel therapy for war zone vets and their family members. And I started off working for the VA in the vet center program, worked for the homeless program for a couple of years, and then I made my way into suicide prevention as I had a real calling to that when I'm as unfortunate as it is, without sharing, you guys wouldn't understand. In 2021, I lost 3 people I served in Iraq with in 3 consecutive months to suicide and unexplained causes. So that's really the heart of why I do what I do, is to help people in those situations. And the other stuff is just going to talk about my job and safety planning and what is lethal means safety. Next slide. So we know I mean, I'm not speaking to deaf ears. You guys, everyone knows that suicide is a major problem that we're dealing with. It's a top 10 cause of death now, and here in Idaho, it's the 2nd leading cause of death for ages 14 through 40, based off of the American Foundation on Suicide Prevention stats I was just looking at. So really, it's multiple factors contribute to the issue. We have identified it as VA's top priority, and whatever that means to you, it's just kind of like we're focusing a lot of our resources and therapy and healthcare centers are focusing on how to address the issue of suicide prevention. One thing that always breaks, it's kind of really sobering to read that 4th bullet there, where one suicide notably affects an estimated of 135 people around. So that's me, that's you, our providers, people in the churches, in the communities and schools, families. The list goes on. So it's really like a ripple effect with a suicide event happening, and then the amount of people that are impacted. And yeah, it's similar to the nation, veteran and non-veteran. So this is a really good thing that we're talking about, because it's really relatable to the common people. However, veterans and service members are at a higher risk for suicide. Next slide, please. So these are, I'm just trying to go as fast as I can to not bore you all, but these are the 3 priority areas that I work with, and I identify service members, veterans, and their families, and help communities screen for suicide risk, promoting the connectedness and care transitions, and increasing lethal means safety and safety planning. So these are more upstream approaches to suicide prevention, and reaching the veterans on where they are is my priority. I have colleagues who do answer the phone from the Veterans Crisis Line, and they do all the clinical work, but my role and what I do is more going out into the rural areas. We know Ada County is huge and has a lot of resources, but I've been going up to places like Twin Falls, Wood River Valley, all the way. I'm trying to get up to Salmon and as far out to Ontario as I can. So I have a big catchment area. And the next slide, please. This is the CDC's version of the national strategy to prevent suicide, for suicide prevention, as I was. So it kind of, I blend, the VA program they looked at the priority areas, and they took these 7 strict priority areas and made it into 3, which was on the slide that I just showed. So it's just kind of a reference to say that we're in line with the national CDC, and we have a national program that's focused on these strategies. So I just wanted to show you all how it looks from the CDC's perspective. Next slide. All right, so I kind of briefly mentioned how all the overview of what I do and everything, but the remaining of this presentation is exactly like where the rubber meets the road. And some of these programs, they may jump out to you. If anything you want to implement in your healthcare setting or in your private practice, I'm open an invite to you to get in touch with me, and I'll try to make it happen and give all the resources I can. But this is the first priority area, the part where we identify service members, veterans, and families. That's what SMVF stands for. We're coming up with more inclusive ways to ask. The question is not only are you a veteran, which some people don't even respond yes to, and clearly they have served in the military. We like to have more inclusive question like, have you or a loved one or any family member served in the military or U.S. Armed Forces? And we have different strategies from when they say yes versus no that I help implement throughout healthcare systems. And and then there's a national effort to kind of having more open doors for veterans. So it's just a call to action. These are all call to actions, and if you have any ideas, I'd love to talk more about it. But we also know that family members are a huge door into connecting with our veterans and service members in our community. I can't even tell you how many people used to drive to the vet center I worked at and dropped off a veteran and said, "Hey, Travis, can you help out uncle, auntie, cousin, sister, brother, whoever, father?" And then it's like, wow, I just opened my eyes to seeing how the impact of the family, the veteran status is on the family. And my wife could attest to that. She has a million stories about funny things that she identifies with being a family member. But so these are just the first step. Next slide, please. Also, we like to, we know screening and suicide risk assessment is not a predictor of suicide, but it's a tool that can be used collaboratively to kind of mitigate the risk through individual safety and treatment planning. So, however we do it, there's the VA, I use the VA a lot because I work for us. We have like the PHQ-9s and the TCL-5s and a bunch of the intake paperwork that we have, and some of those have questions of if they're suicidal, or we can identify stuff like that through those intake paperwork. But wanted to explore some opportunities that you guys use when approaching and screening for suicide risk. I just echo that it should be patient-centered and inclusive of diversity. So it's like just a good time to let people know that you're worried about them, and if they're concerned, you can ask it a certain way. We don't want it to be a part of just the regular paperwork that we give our patients and clients and just tell them to fill out, but should be a collaboration. The next slide, please. So promoting connectedness. These are great examples on the PowerPoint of how we can help people feel more connected and have places to go, people to talk to, have like resource lists. The Idaho Division of Veteran Services has a resource guide that's inclusive. It's a nationwide thing, but they put money into the Idaho sector, and they have, it's Idaho Veterans Guide. You can just Google search that, and it has a whole bunch of local resources. Once you put your zip code in, you can find out anything from healthcare, mental health, resources in the community, anything like that. And we also have connectedness campaigns like Don't Reach Out. You may have seen some of the YouTube videos that the VA put up on like sports, like the football games already, or whatever commercials you're watching. They have the Veterans Crisis Line. They're putting a lot of money into filming and doing these media projects to have good ways and have promotional stuff that the community can be exposed to. Next slide. And these are some ways that myself and other groups that I work with can also identify gaps and improve care transitions. You know, as we know, there's a greater severity or risk when people get discharged from inpatient services for suicidality. So here at the VA, we have implemented like a four contacts after their discharge kind of thing, and you can use any number, but we have 4 that we have mandated for us to try and engage a veteran after they're discharged from inpatient hospital, psych ward, the substance use facility that we have, and I think it's a great way to keep people in, you know, improving those care transitions. We'll go on to the next slide, please. So this is a hot topic, as we are in a mountain state in the north. You know, like we have a lot of firearms in our communities, and people are safe. We definitely appreciate people who are safe, and we want to just help increase providers' understanding, or the community's understanding, or any veteran service organization, or even like the local law enforcement and first responders on how can we come together and have good strategies to, you know, pass out firearm cable locks, or have, you know, first responders be on the lookout for certain things, or even in emergency rooms and emergency departments where they could have like just a firearm cable locks available for anyone that wants to come in and grab one, no questions asked. One of the big partners that we have nationwide, starting when I started working for the VA, we never really brought up this kind of topic with our clients or in the community, but the National Shooting Sports Foundation, they're really strong partners with the VA, and they have nationwide leadership, and we're trying to engage them locally here in Idaho to get them to come to the table and talk with some of the groups and coalitions that I work with. So that's just overview, and next slide goes into why is lethal means safety important. Really near and dear to me. I served with the Marine Corps unit, and my friend, he was a 5-tour combat Marine. He served in Iraq and Afghanistan multiple times, and I went over his house one day, and he was showing me all his firearms and just doing a guy thing, and I noticed that 2 of them were loaded and not stored safely, and I brought it up to him, and you know, I wasn't like really trying to come down on him. He didn't do anything wrong, but just the education part that he was open enough to hear from me, and you know, he kind of a year later, you know, we still hang out and everything, and he invited me over, and he's showing me everything stored correctly, and he has 2 babies now, and everyone's safe at home. So that's the whole point of it, is just trying to have that connection to where they can understand why it's important, what they can do at home if they're in crisis or anything. But really sad statistics is that 68% of the firearm of suicides in Idaho are firearm related. So that's a big number. And then, you know, down there in that last bullet is the 1/3 of veteran firearm owners store at least 1 firearm loaded and unlocked. So that was exactly the point of my story that I shared, to kind of just have a conversation with someone, ask them what's going on at home and everything. And the next, we go to the next slide. We have I can get you, or the VA, the Boise VA, any VA can get you any amount of firearm cable locks. For the Gowan Thunder Air Show, I ordered 3,000, and we were having available throughout different points on the base during that event. I send them out to the St. Luke's healthcare system. Probably see some of them in the emergency rooms. But I believe that having a little mechanism to put time and distance in between the thought and the act is very valuable, and it's all about how we make them available and what we say and the messaging that comes with it. So anyways, that's our the way to find out the nationwide programs, but later on I'll give you my local contacts so where you can get right in touch with me if this is what you want. The cable locks come with a little 988 Veterans Crisis Line. It has a little card in there that has ways to identify if someone's at risks and what to say and how to, other resources like that. So go to the next slide. The overall goal with safety planning is to create a high quality safety plan with the service member or any of your patients. I mean, you might use this across any population that you work with, but it's a collaboration. You pretty much want to have it be a central piece of the conversation. That way you can keep up with it's like a living document. And on the next slide, it'll show you exactly what a safety plan looks like. It can be used during a suicidal crisis, or even if you just want to let people know about their coping strategies. So it's a wide range of use. It identifies people, it identifies what's warning signs that we should look out for ourselves, people to call, places to go, implementing the coping strategies, numbers, and so on. So even if you want to consider giving one of these to the family members of your patients, or have a copy that you can have your client or patient take a photo of and update it as they go. But the VA also came out with an app that it's called Safety Planning, and if you look it up, you can find out more and share it with your clients. That way they have it available on their own phone whenever they need it. Okay, I know that was really quick, but I had kind of pushed through a lot of the information just so we can have time for conversation and questions at the tail end. These are some of the resources that Shannon wants to, let them be available so that people can see them, and references that I have. But yeah, I would love to help out any community or any of you individuals that want to focus on these strategies. So if you have any questions, I'm kind of done with my presentation. Sorry it was so quick.
No, that's great. We love time for questions. And Travis, I know that you sent me those resources earlier, and so Hongyan just dropped the links to those. I don't know, do you want me to pull those up to go through them, or do you just want to quickly talk through the 4 resources that you sent?
Yeah, sure. I'll start off with the lethal means training flyer. We have free classes that are available with CEU options and everything like that. So if you want to check out that flyer, it has a place to go where you can make an account on. It's called VHA Train, which stands for Veterans Healthcare Administration. I don't know what the train stands for though. Sorry, but free resources throughout that website. The second one is a healthcare resource flyer for us, in the healthcare field and providing services to a wide range of people. You may come across a veteran and you want to know more about crisis resources or VA disability benefits. That flyer has a lot of QR codes that you can scan and get more training, get more education, anything like that. The third one is the same. It's more for the veterans and the caregivers version of it. So it has more specialized stuff for caregivers and information more relevant to the veteran. The VA Save is maybe an hour and a half. They have an online version that's 25 minutes, and that's really fast, but it's an in-person training that we can come to your location, and myself and my colleagues, the suicide prevention specialists, and our coordinator here will come do a training, and it's great. It's an acronym that stands for signs and symptoms of suicide. Ask the question, are you suicidal? And validate the experience and encourage and expedite to get help. Everyone has a different acronym. That's just the one that we have for the VA, and I think it's pretty useful, and it kind of goes over the military culture and other specialized resources that may be relevant to the VA, the veteran community. Well, that was 4 of them.
Thank you, Travis. And those flyers, Hongyan put all of them into the chat there, and they're in order. So feel free to take those and use them and have them for your reference. But we're going to open it up to questions. So any questions that you guys have for Travis about this topic in general? Great. I see that Travis is putting his contact information into the chat for you guys too.
Hey, it's Dr. Whitaker. Can you hear me okay? Thank you so much. I think the safety planning is something that I feel like evolves over time. And I think we started asking about suicide prevention or like suicidality with every patient in our clinic. And I think that's becoming more and more of a trend in primary care. But I think, you know, it's constantly evolving. And I think, you know, it's really helpful, that kind of idea of how we help people with their lethal means. Because I think, and I know you already addressed it, but I think one of the things I struggle with sometimes is I'm asking them like, hey, make this plan, but maybe if you could speak a little bit more to, if I have somebody who's like a little bit reluctant, or, you know, we're negotiating like, yeah, they'll do it. But do you kind of follow up, like have someone call the next day and be like, did you put the guns where you said you were going to? Or I guess, how proactive should we be about like people following through with their safety plan? And usually I'm trying to hook them up with counseling, obviously, and kind of a team approach. But I just wanted to know if there were any other thoughts on that.
I would always err on the side of more conversation about it is better, because even if you have someone who's reluctant to do it or even find out about it, that may be the connection that they were looking for to talk about it. And you know, you can tell people's body language if they're comfortable or not or whatever, but at least they know that you're available and willing to talk about it. And you know, so it's like a collaboration and kind of a negotiation in a way. When you're when someone's in crisis, it's like a dance. So hey John, you told me, you know, to look out when you're in crisis. These are 3 things, and this is what we should be looking out for. It's going on now. You know, wouldn't you be open to having a plan or something that you could take home with you to look at? And then it kind of invites them to say, yeah. And so there's a lot of conversation and negotiation with things, especially when they're in crisis. It's like, who can you, so not every state does this, but who can you give your firearms to, or who can lock them up for you, or can you drop it off with a friend? Or can you take the gun lock that I just gave you, hypothetically, and take the key, lock it up, take the key, put it in a glass of water, and put the glass of water in a freezer. That way you have more time and space in between that thought. And, you know, wouldn't that be helpful kind of stuff?
No, that's super helpful. And I think that's what I love about like the safety plan approach versus like when I was first in training, we talked more about like content, like having someone sign something saying they weren't gonna, but it's so much better to like have that conversation and that kind of like really have them come up with that solution. It does feel a lot more, you know, like you're getting to know them better. So I think that's awesome.
I have lost way too much sleep being a therapist. And, you know, when I started my clinical social work stuff, that was still like the safety contracting and everything. People were telling me, haven't signed this paper. I was like, that's crazy. So I'm so much better off with doing the safety planning and having them have ownership of it and collaboration with me as a provider. And it's really helpful for all types of providers, all professions. So that's really good to hear that primary care is taking this initiative. Thank you.
Yeah. I guess the only other thing I was going to add is I don't know how much we're doing outreach, but specialty clinics. So I just heard a really awful story, and she's fine, but she went to see a specialist, like an OB provider, and brought up mental health, and they did not pick up on it. And so just was such a good reminder that at any point in that spectrum, making sure that if someone arrives to care, no matter who they say that to, that person kind of takes that invitation to offer them support. And so I think, yeah, I hope over time it kind of bleeds out into other realms of medicine.
Yeah. Good.
I was reminded when you were on and put up the slide with the completed, what a completed safety plan looks like. I was thinking to myself, do I know where to find a resource for a safety plan? And then I thought, oh, I think we have an ECHO resource page. And I was able to, within like 3 minutes, even while Tara was just talking, find the wallet size link that we have in there. So just if anybody's wondering where a free access to that is, it's in our links in there.
Totally recommend doing one for yourself. It's cool just to get the experience, and that way you can talk to people about it. And heck, even if you have that moment where you're thinking like, oh wow, it's an aha moment where you think of something that's really a positive coping strategy for yourself. It really brings all those things to light.
Thanks for bringing that up, Stephen. Hongyan's putting the link to that session resource page in right now. And just so you know, you can find that on our ECHO website under current series and then behavioral health and primary care. And Hongyan did just link it in. That is an extensive list of resources. Use your control find, you'll get there. Rachel, did you have something?
I did, thanks. Travis, I'm wondering if you have any thoughts on, I think sometimes a conversation that admittedly I struggle with too is working with, you talked a lot about the family members and the caregivers and the support, from the support staff, right? The people who are at home and the loved ones. How do you have any pearls on having that conversation with family members, loved ones of someone who is struggling either with suicidal ideation or attempts or things like that? I do find that that's such a it's such a terrifying and helpless and frantic and really, really, really tough spot for caregivers to be in. And we hear the question a lot of like, what do I do? What do I do? What can I do? And a lot of it is, what can I do to prevent this from happening? What can I do to prevent them from moving forward? And so what are those pearls that you give to those family members without, I think the thing that I struggle with too is balancing, like, how do we help them help their loved ones without encouraging them to take it on? Do you know what I mean? To take on responsibility and to take on the responsibility for preventing that situation from happening all themselves. I don't know. Do you have any thoughts on that?
Yeah. Even to a confession that I was at the Out of the Darkness walk this past in October last month, and I was talking about the firearm cable lock and had one in my hand and was saying, yeah, it would be great if we had these available. And then the person I was talking to, she said, yeah, I wish I'm not gonna use his name, I wish Johnny had one of those before he took his life. And it really kind of, wow, as recent as that was, it still brings some emotions to me. But offering trainings, offering resources, making them available and visible so that way people can see when they come into your place. But also with respects to safety planning is involving the family and having them be part of that safety plan. So that way we as a provider can have that open conversation about, I'm really concerned about Jim, so-and-so is going on. I think if you had more, if you ever had anything you needed, you can come to me, kind of thing, without taking it too much of a burden on your own. But making the resources available and promoting it as much as you can is one way. We don't really have a good answer for that, because the burnout rate with caregivers is so high too. So it's kind of like a double-edged thing where we're not only needing to focus on the individual caregiver, but also that relationship and whoever they're caregiving for. So, you know, if they're worried and they're concerned, we can talk about all the respite services and offer them training on how to talk to people in crisis. But I mean, we can't prevent everything, and we don't want to get so laser focused that we miss other things that are going on and other risk factors. It may not be the best answer, but it's we're all struggling to find out too.